Hello, everyone! Having completed the previous study of vertebrae, today we will proceed to the study of the sternum, ribs, and shoulder girdle bones. First, let's look at the composition of the sternum. The sternum is located in the middle of the anterior chest wall. It is convex anteriorly and concave posteriorly. It can be divided into three parts: the sternal manubrium, sternal body, and xiphoid process. Next, let's look at the structure of the sternum. The sternal manubrium is wide superiorly and narrow inferiorly. The middle part of its superior border is the jugular notch. There are clavicular notches on both sides, which articulate with the clavicle. The upper part of the lateral border of the manubrium connects to the first rib. The junction of the manubrium and the body protrudes slightly forward and is called the sternal angle. The costal notches on both sides can be palpated on the body surface, which are connected to the second costal cartilage, and serve as an important landmark for counting ribs. Posteriorly, the sternal angle is level with the inferior border of the fourth thoracic vertebral body. The sternal body is rectangular in shape. Its lateral borders connect to the second to seventh costal cartilages. The xiphoid process is thin and elongated, with significant variations in shape, and its lower end is free. After studying the sternum, we will next study the ribs. The ribs are composed of costae and costal cartilage, with a total of 12 pairs. Classification: the anterior ends of the first to seventh pairs of ribs are directly connected to the sternum, and are called true ribs. Among them, the joint between the first rib and the sternal manubrium is a cartilaginous joint. The second to seventh ribs form slightly movable sternocostal joints with the sternum. The 8th to 12th pairs of ribs are not directly connected to the sternum and are called false ribs. Among them, the anterior ends of the 8th to 10th pairs of ribs form interchondral joints with the ribs above via cartilage, forming the costal arch. The anterior ends of the 11th to 12th pairs of ribs are free in the abdominal wall muscle layer and are called floating ribs. The posterior ends of the ribs form costovertebral joints with the thoracic vertebrae. The connections of the ribs include cartilaginous joints, synovial joints, and cartilaginous connection. Next, we will proceed to the study of the shoulder girdle bones. The shoulder girdle bones include the clavicle and scapula. The clavicle is shaped, curved and spanning the upper anterior part of the thoracic cage. The entire length of the clavicle can be palpated on the body surface. The clavicle supports the scapula outside the thoracic cage to ensure the flexible movement of the upper limb. The medial end is thick and is the sternal end, with an articular surface that articulates with the sternal manubrium. The lateral end is flattened and is the acromial end, with a small articular surface that articulates with the acromion of the scapula. The medial 2/3 protrudes anteriorly and is triangular rod-shaped. The lateral 1/3 protrudes posteriorly and is flattened. The junction between the two parts is relatively weak. Clavicle fractures commonly occur here. X-ray films show the fractured ends of the clavicle. Let's take a look at the anterior view. The scapula is a triangular flat bone attached to the posterior outer surface of the thoracic cage between the second and seventh ribs. It can be divided into two surfaces, 3 borders, and 3 angles. The ventral, or costal, surface faces the thoracic cage and has a large shallow fossa, called the subscapular fossa. The flattened projection extending laterally from the scapular spine is called the acromion, which connects to the acromial end of the clavicle. The superior border is short and thin, with a scapular notch in its lateral part. Lateral to the notch, there is a forward finger-like projection called the coracoid process. The medial border is thin and sharp, adjacent to the spine, hence also called the vertebral border. The lateral border is thick, adjacent to the axilla, hence also called the axillary border. The superior angle is the junction of the superior border and the vertebral border, level with the second rib. The inferior angle is the junction of the vertebral border and the axillary border, level with the seventh rib or the seventh intercostal space, serving as a landmark for counting ribs. The lateral angle, the thickest part at the junction of the axillary border and the superior border, has a pear-shaped shallow fossa facing laterally, called the glenoid cavity, which articulates with the humeral head. There is a rough prominence above and below the glenoid cavity. called the supraglenoid tubercle and infraglenoid tubercle respectively. On the posterior view, the dorsal surface has a transverse ridge, called the scapular spine. The shallow fossae above and below the spine are called the supraspinous fossa and infraspinous fossa respectively. The scapular spine, acromion, inferior angle of the scapula, medial border, and coracoid process can all be palpated on the body surface. Dear classmates, in this class, we have studied the shoulder girdle bones. In the next class, we will start studying the free upper limb bones. Thank you.